my dissertation research specifically was looking at the dyadic interactions, or the specific interactions between different team members across a couple different healthcare teams, and how those interactions then drove things like attitudes about each other, as well as willingness and to trust in and work with one another. And specifically the role of having a team member take initiative on the team and then seeing how others on the team actually react to that initiative, whether it's positive or negative, and if those reactions drive their willingness to actually trust that person as a team member. And if they don't trust a person as a team member, the likelihood of and you add up all these interactions together, the likelihood of a team functioning well diminishes without those trust factors. And so what I found is that we can definitely build trust across different health professions. And in terms of in a world where we really are encouraging people to seek out, to be initiative, or to take initiative, to be innovative, to try to make suggestions, to make improvements to how your unit does things, that's something that's highly encouraged, but not always well received by fellow team members. And the way that we can improve these efforts and improve how others on the team receive someone else's initiative is really to highlight those teamwork skills that are so highly valued from an interprofessional perspective, as well as an IO perspective. And so training teamwork skills early on, I think, can really go a long ways in driving sort of trust in one another and breaking down those professional barriers. In addition to the teamwork skills component that I studied with my dissertation, I also included a roles component, or a profession component. And while that profession component is very important in terms of the clinical skills they bring to the team and the clinical skills that are needed to provide that effective patient care, what it boiled down to is that it's also very important to develop and have students understand the value that they need to bring in terms of the skills of how to be an effective team member. And that it's not just enough to have the clinical skills to provide for your patient, but in this day and age, it's very important that we develop the teamwork skills to make them valuable and effective team members, as well as well-respected and trustworthy team members. And then that trustworthiness will only enhance the overall teamwork and patient care that they provide. I will continue this stream of research for the time being. I see a lot of value in it. It is important to note that the research I did was across two very different teams. One, an academic pediatric focused team, and another, a very much kind of local healthcare providing for adult neurology. And so these are two very different teams and made up differently. And we found very similar things across both of them. So that this tells us that this research really can go a long ways in helping healthcare teams across a number of areas, across a number of situations and environments. And so I'd like to continue to collect data with teams from other organizations and other capacities to really continue to better understand these interactions that happen among team members and how these interactions then continue to drive effective teamwork and effective team outcomes, including quality patient care. And so I think that in addition to the research side of these things, we can also start to understand, by understanding these interactions, we can then do a better job of prescribing, so to speak, the appropriate tools that these teams can use to only become better. And with the teams I worked with, after analyzing the data and working with them through the research process, I was then able to provide reports back saying, these are some areas that if you were ever interested in working on, here are some tools that can help you in these areas, and here are really your strengths and weaknesses as a team. And so continuing to do these evaluations, I think, will really help from the actual real world view of this, in terms of making sure we're continuing to give our healthcare teams the tools they need to continue to grow and be better.